UCLA Lung Transplant Program Education. Your physician has requested a lung transplant evaluation for you because he or she believes your lung disease may be severe enough to require lung transplantation. Lung transplantation is indicated for patients who suffer irreversible or untreatable damage to the lungs and whose life expectancy is thought to be less than 1 to 2 years.
In this portion of the lung transplant education video, we will be reviewing general information and resources about our team. In addition, we will be discussing benefits and alternatives to lung transplantation. The UCLA Lung Transplant Program oversight and governance consists of hospital administration, which encompasses the hospital CEO, CFO, Chief Medical Officer, Chief of Surgery, Chief of Medicine. In addition, we have some federally regulatory bodies that oversee our program. This consists of Medicare, also known as CMS, the United Network of Organ Sharing, which is known as UNOS, also stated as UNOS. Transplant administration includes the Director of Transplant Services. In addition, there is a surgical director and medical director and transplant nurse manager overseeing the lung transplant program. Every transplant team consists of specialists from multiple specialties, including but not limited to transplant pulmonologists, transplant surgeons, transplant coordinators, transplant social workers, transplant dietitian, transplant pharmacists, and hospital nursing. The transplant pulmonologist. This physician is responsible for providing and coordinating your non-surgical transplant evaluation and services. The transplant surgeon. This physician is responsible for performing your transplant surgery and any associated surgical services, as well as coordinate consultation with other surgical services if needed. The transplant coordinator makes sure all of your needs are met both pre and post-transplant and is your link between you and all of the members of the transplant team to ensure that you and your family receive coordinated communication and care at all times. The transplant social worker provides any and all social services you and your family need throughout the evaluation and following transplant. The transplant dietitian provides nutritional evaluations, services, education, and counseling. The transplant pharmacist provides medication review and education to you and your family and assists your doctors in providing your personalized medication routine before and after transplant. The transplant psychiatrist conducts an in-depth psychiatric assessment and evaluation prior to the selection process and provides recommendations to the team. The transplant financial coordinator provides assessment, counseling, coordination, and verification of your insurance benefits and financial resources for transplant evaluation, transplant surgery, and costs following surgery. Many other medical and multidisciplinary professionals will also participate in your evaluation and care before and after transplant. All of our transplant programs are staffed by physicians and surgeons 24 hours a day, 7 days a week. We are available to accept organ offers on your behalf, perform transplants, and provide post-transplant care. We have a designated primary surgeon and primary physician for each of our organ transplant programs. None of our programs is a single surgeon program, so there is never a time when a transplant surgeon is not available to provide the above services. The lung transplant office may be reached at 310 825 6068, Monday through Friday from 8 a.m. to 5 p.m. We are closed on weekends and holidays. After hours, a lung transplant coordinator may be reached at 310-825-6301. The lung transplant nurse manager may be reached at 310-267-8290. UCLA Transplant Administration may be reached at 310-267-9033. UCLA Medical Center Office of Patient Experience may be reached at 310-267-9113. Our website can be found at the link provided. The benefit of lung transplantation is improved lung function, which can enable normal activity. Besides improving life expectancy, goals of lung transplantation include returning recipients to an acceptable quality of life without being limited by difficulties of breathing or what activities you are able to perform. Alternatives. Depending on your medical condition, there may be other treatments available to you. Our team will discuss those in detail once we have determined the status of your lung disease. There are many ways lung transplant surgery may improve your overall health or quality of life. You may achieve improvement in your overall physical functioning. You may receive benefits in your overall general health. You may perceive benefits in your overall mental health. Your perception of improvement depends on your recovery following surgery, including any medical or surgical complications that may occur, and any emotional, social, or other factors that may influence you post-transplant. Some alternatives to lung transplant include optimized medical management is an alternative to transplantation. However, this is not always effective for an extended period of time. Hospice or end-of-life support are also treatment options for you. If you decide not to have a transplant procedure, there may be associated risks to this decision. It is your right not to pursue an organ transplant. Please discuss all options with your doctor. Our social worker or advanced care planning team can help you complete an advance directive so you can document your treatment wishes. Blank copies are included in your evaluation book for your review. Your physician is always available to answer any of your questions in regards to the specific medical condition or specific treatments discussed in the advance directive.
You have the right to change your mind about being evaluated for or undergo lung transplant surgery at any time prior to the start of the transplant surgery. We must obtain your written consent to begin the transplant evaluation process and again to perform the transplant surgery. This will not affect your care at Ronald Reagan UCLA Medical Center, and you will continue to receive care for your lung disease in collaboration with your referring physician.